Carol Horton is the Vice President of the Clyde Health Foundation and has been actively involved in the fight against the coronavirus, raising funds for the frontline workforce at Clyde Health. Carol, thanks for joining us today.
Hi, Mike. My pleasure.
Tell us a little bit about the foundation these days and how you guys have been actively involved in the organization's fight against COVID-19.
Well, we've had to pivot our strategies, as you can imagine, just as all of society has. Instead of having a face-to-face fundraising effort and really having a lot of fun with events and really touring potential donors around and showing them what we do, instead we're having to do a lot of things like this virtually. But I will say that people have really stepped up.
Yeah, tell us a little bit more. What has the community response been like for you guys?
It's been wonderful. I will tell you, all told, we launched our COVID response fund on March 18th. And since then, we're closing in on $400,000 in cash and nearly $100,000 in in-kind donations in the way of food donations, goodie bags that have some pajamas and lotions and feel-good things in them for our frontline workers, and even grocery sacks so that our workers don't have to go to the grocery store after their double long shifts.
That's remarkable. $500,000 in about 6 weeks. Tell us some of the specifics about what the foundation is supporting through the fund.
So the COVID Relief Fund is really targeted at doing anything it can to assist that frontline workers. So one of the things has been meals. We've had a lot of support with meals. People, again, are working very long shifts, and many times they're working double shifts. Obviously, probably one of the most stressful times of their entire career. So just to be able to have the foundation provide a meal so that they don't have to worry about trying to get something or grab something or remember to bring something into the office, we've been able to support them with things like that. We've also been helpful with equipment and helping other partners get in touch with the right folks at the front lines to make sure they have the proper masks, whether they be those face shields or a procedural mask. We've been involved in that. And also something that's come up is the need for some workers to stay in hotel rooms. Many folks obviously are concerned about their exposure to the virus, and they might live with very young children or elderly parents or grandparents, and they don't want to bring that home to them. So we're in a position now through the foundation to be able to help those folks stay in hotel rooms for several nights to kind of ease their anxiety about what they're bringing home to their families.
Carol, we're practicing social distancing now, obviously, but you have had the good fortune of obviously seeing the frontline workforce in action and watching them benefit from some of the efforts that you and your team have been able to come up with here. So tell us the difference between, prior to the coronavirus and now, your time in the hospitals and rounding on units back then. Say since mid-March, what has your experience been like? What have you seen? What have you witnessed?
I mean, talk about ripping the Band-Aid off and seeing just how intense things are. It is quite remarkable and quite humbling to see what people have been training for their entire lives and how they're just going full force and doing anything they can to help our patients. They say adversity breeds community, and it's never been more evident when you see the frontline workers and their commitment. And obviously they're stressed, but they are resilient, and it's a very inspiring and humbling thing to be a part of.
In your time now with the organization, coming from your previous background and coming into the hospital system, did you ever imagine you would be in the middle of something like this, even though you were in the foundation and the fundraising mode? You guys are on the direct front line and helping our workforce. Did you ever imagine something like this when you came over to the organization?
I really couldn't have imagined anything like this. I mean, the word unprecedented keeps coming up over and over, but I think for very good reason, that no one could really see how this could possibly affect everyone in our entire community, our entire society. And in many ways, I think it's brought us very much closer together, at least emotionally, even though right now we have this physical distancing thing right now. But it's interesting to see just the effect that it has on human beings. And I think at the end of the day, something like this really brings out the best in everyone. And that's what we're witnessing now at the foundation.
Like you said, there's some new initiatives that are going on, and obviously in new ways, virtually through social distancing, through Zoom calls, things like that. New giving program called Giving Tuesday now on May 5th. Can you explain a little bit what that is for our viewers?
So Giving Tuesday is something that's become popular over the last couple of years, traditionally on the Tuesday after Thanksgiving. And it's very much widely a social media effort, and folks will advocate through their social media for the foundations and causes that are near and dear to their heart to ask people on that Tuesday after Thanksgiving and that time of the holidays to perhaps reach into their pocketbooks and make a donation. So with the pandemic, Giving Tuesday is going to have a bit of a reprise this time of year, actually going to be on Cinco de Mayo, but that's good because it's easy to remember Cinco de Mayo, right? So this coming Tuesday on May 5th will be another Giving Tuesday this year, and it will all be dedicated to COVID response. So if folks follow Kaleida Health on their social media, they will be able to see how they can give and how they participate and how their donations will help our frontline workers.
That's great. As we wrap up here, as I said, you've seen this up close and personal now for the last 6 or 8 weeks, but you've also been on the other end of emails, phone calls, text messages, video chats with people in the community, businesses, some sports organizations. Tell us what it's like to be on the other end of that and have people express their support and wanting to help.
Everyone wants to help. I mean, everyone wants to help, and everyone wishes that they could help even more than they are, which is really a delightful thing to see. And again, just really makes you realize the spirit of Western New Yorkers and how we are all in this together and everyone wants to help. And all we can do is thank everyone from the bottom of our heart. I keep saying, I can't wait to thank you in person. And so there's so many people to thank at this point. We're going to have to start filling up the calendar right away into the next couple of years. But you know what? That is a great situation to have. And I really can't just thank everyone enough for supporting us.
Well, Carol, thank you to you and your team for all the work that you guys have done for the last 2 months, working on behalf of the front line of the Kaleida Health workforce. Thanks again for that, and thanks for joining us today.
It's the least we can do. Thanks, Mike.